Alright, today we're going to talk about Unit 9 in Nursing 121, GI&GU Assessment Skills. First thing we want to do is identify our patient with our two identifiers, name and date of birth. We want to perform our skill riders. We want to make sure we're providing that privacy. I'm going to wash my hands, explain procedure, introduce myself, and gather any equipment I may need. We want to ask two pertinent history questions for the GI. Any appetite, dysphagia, any trouble swallowing, any food intolerances, pain, nausea, vomiting, bowel habits, any abdominal surgeries, and current medications and nutrition. We also want to make sure we're asking two GU questions. Any burning with urination, difficulty urination with males, asking about prostate issues, any foul odorous surgery, or any complications. Then we're going to move straight in with inspection. With this, we're looking at the contour of the abdomen. We're kind of from a side view. We would normally come from the right, but for the video we'll do it from here. We're looking for, is it flat, is it rounded, is it protuberant, is it bloated? Then we're looking for symmetry. Do I see any masses on one side, or is it abnormally shaped on one side and not the other? Any bulges? I want to inspect the umbilicus, making sure that it is midline and inverted. Is it inverted or is it protruding? We want to inspect the skin. I'm looking for even color. Do I see any patches? Do I see any scarring? Any stretch marks? Do I notice any piercing? And checking the turgor of the skin. Any scars too. A lot of times you'll see surgical scars. You want to inspect for pulsations or movement in the abdomen. Sometimes in very thin people you will see the aorta pulsate, and then sometimes in cases of aortic aneurysms you can see those as well. We're going to inspect for hair distribution. For males you expect a diamond shaped around the umbilicus, whereas to females you expect an inverted triangle. We want to inspect the demeanor of the patient. Do they look relaxed? Do they look tense? Are they grimacing as we're doing through this? Now we want to move on to auscultation. Here it is important that we are going to listen before we feel. If we happen to percuss or palpate before we listen, then we risk making bowel sounds that may not have been there. When we are doing our bowel sounds, we use our stethoscope and we're going to listen to all four quadrants. Think about putting a mark down here, one down like a big plus sign down the middle. We got our right lower, right upper, left lower, and that's how we will follow our pattern here, starting here, moving here, and going through all four quadrants. As we're going through these four quadrants, we're listening for bowel sounds. They're either described as normal active, hypoactive, or hyperactive. Normal is just you expect your normal gurgles every little bit. Hypo, they may be seconds to even minutes apart. Hyperactive is just a constant gurgle. And in thinking about the possibility of absent bowel sounds, we have to listen to each quadrant for 5 minutes to make sure that those bowel sounds would possibly be absent. If you have absent bowel sounds, a bowel auscultation will take at least 20 minutes. We would start here, right lower, normal, and that would be listening to the bowel sounds, describing those as neuroactive. Now we want to assess for some vascular sounds in the abdomen. We want to listen for the aorta, renal, iliac, and femoral. We will just verbalize the femoral, but as we go right below the manubrium there under the sternum, we'll use our bell to listen for the aorta, listening for any bruits. And then right beside those, we will listen to our renal arteries. And then if you go on the outsides of the umbilicus, we'll listen for our iliac. And then femoral. We want to percuss all 4 quadrants. They want you to use a zigzag method. And again, from our respiratory, we're using that middle finger, and you would expect the tympanic sounds as you're doing this. Then it wants you to percuss your liver border. This will be on the right side, on your right mid clavicular line. You're going to start up here. We're listening, and as we're in the lung, we expect resonance until we start to feel that dullness here, and then we would make a mark going from your abdomen paying attention to that dullness, making a mark and measuring that liver, the borders on both sides, usually expecting anywhere from 6 to 12 centimeters. Then we would do the same on the other side for our spleen. We would have to percuss for costal-vertebral angle tenderness, which is where we would place our hand at the bottom of the 12th rib, and we would palpate with this. If you want to sit up, you would look at under your 12th rib here, and then we're going to, and do you have any tenderness?
No.
Alrighty. And you want to palpate through our abdomen here. You want to start with light palpation using 3 fingers and gently pressing on the abdomen. Again, still following that same pattern here, starting in right lower. We're feeling for any masses. As we're palpating, we want to make sure that we're monitoring the face. Do we see any discomfort, any grimacing as we're doing this? We'll do our light palpation, and then we will we would perform deep palpation. This is again a verbalization in all 4 quadrants. We would perform a liver palpation, and we would palpate the spleen. Those are all verbalized. Then we would assess how often the patient is going to the bathroom in a day, assess how much urine is being output. We want to know the color, odor, and consistency of the urine. And for males, we would want to complete a testicular exam. At the end of the assessment, we would want to discuss all the findings with the patients using appropriate language. Again, we try to avoid using medical jargon while talking with the patient, and then we would document those findings. And that will be all.